Namaste again, everybody, and welcome to today's Facebook Live program, which will be on managing heart disease and learning about heart disease from an Ayurvedic perspective. I'm very excited to be here with all of you to explore this really very, very important subject. You know, heart disease is actually the greatest threat to our health and our well-being. Heart disease is the #1 cause of death in the United States. There are many things that we pay attention to. This is being recorded during the COVID-19 crisis. And right now we're paying a lot of attention to that. And it's very important that we do. It's incredibly important that we do. Yet at the same time, we need to always pay attention to our hearts. Our hearts are so vital to our well-being physically, emotionally, and spiritually. And heart disease, as I mentioned, is the #1 cause of death in the United States. In fact, every 30 years, someone will die in the United States as a result of heart disease. So that should give you some idea of just how serious this is. It's estimated that close to 700,000 people will die each year as a result of heart disease. That's extraordinary. That's why it's the #1 cause of death. 700,000 people. That's an incredible number. You know, what makes heart disease different than, say, something like the COVID-19 crisis is that the COVID-19 virus spreads from person to person. We are affected by our environment in that way. But with heart disease, so much of it is actually the end result directly of how we've lived our lives. It takes decades to develop heart disease. And it is very much a reflection of how we lived during those decades. Ayurveda provides guidance and insight for people on how to live so that they can avoid heart disease. So we're going to explore that in more detail today. Just a few more statistics for you to bring this home. Okay. While nearly 700,000 people die every year of heart disease, there's a lot of different kinds of heart disease. 800,000 people a year actually have a heart attack. That's extraordinary. That's extraordinary, the number of people that have a heart attack every year. And what's really interesting is that 20% of the people that have heart attacks don't even know they had a heart attack. They had what's called a silent heart attack, which basically means that they had a very small heart attack. And while it may have produced some minor discomfort, they didn't associate it with their heart. And so their heart became weaker as a result of that heart attack. While it weakens the heart, it may or may not kill you. It leads to other problems later on, particularly a condition called congestive heart failure. Congestive heart failure is when your heart is now too weak to pump blood through it. And so the blood backs up, and it backs up into the lungs, or it can back up into circulation. And that's when people's bodies begin to fail. That happens also over many, many decades. Okay? So whether it's congestive heart failure that you're concerned about, whether it's heart attacks that you're concerned about, these are conditions that occur slowly over many, many decades. Now, some people also have some other challenges in their bodies. Some of the challenges in their hearts are going to be electrical. Our hearts work off of what appears to be like an electrical system, and it keeps the heart beating regularly, and it keeps it beating smoothly. And sometimes people have irregularities in their hearts, and the heart rate will go up very high or down very low. And sometimes people will skip beats or feel like they skip beats. They actually have extra beats, but it disturbs the rhythm so much it feels to a person that no blood is leaving the heart at that time. And in fact, it's not. With those extra beats, the heart has not had time to fill back up. And so irregularities in the heart are scary too, and they indicate a weakness as well in the tissue of the heart. So some people have electrical problems in the heart. Some people have mechanical problems in the heart. They might have a valve problem, which is starting to interfere with blood flow through the heart, which means they're prone to congestive heart failure. And some people have obstructive problems in the blood vessels of the heart that give nourishment to the heart. And those obstructive challenges are what typically cause a heart attack. Heart disease is the #1 killer. So let's take a closer look at it now from an Ayurvedic perspective and learn more about what Ayurveda has to say about heart disease, and also what you can do to prevent and also to help you in your treatment of heart disease. Now, many of the people who watch my videos on YouTube and on Facebook Live are Ayurvedic practitioners, and some people are just people from the public that want to learn more about their health and their well-being. So no matter what your level of experience is with Ayurveda, I'm going to try to offer you something so that in the short period of time we have together, this program's about a half an hour, in the short period of time we have together, it'll be a meaningful experience for you, okay? And I want to start with some of the important Ayurvedic information about understanding what's happening in a person that's having heart disease. So this falls in Ayurveda under the understanding of some property or pathology or pathogenesis, what's going on physiologically from an Ayurvedic perspective in the body. And there's a lot that's going on. And so the first thing that I want to just talk about is the importance of the Rasa Dhatu and the Rasa Vahashrutas. Now, if you don't know what that is, the Rasa Dhatu refers to the primary fluids of the body. And the Rasa Vahashrutas are the channels that they flow through. And the heart is closely connected to the Rasa Vahashrutas. In fact, the Rasa Vahashrutas has its origins in the heart. And Ayurveda says that if the Rasa and the Rasa Vahashrutas are not functioning properly, the heart cannot function properly. So in Ayurveda, the care of the heart, the management of the heart, is very much about the management of the Rasa Dhatu and the Rasa Vahashrutas. Now, any dosha can infiltrate this Dhatu and the Shrutas. And when it infiltrates the Shrutas, it disturbs its physiology. So when Vata dosha causes heart disease, and by the way, heart disease in Ayurveda is called Hrid Roga. This just means heart disease. Hrid or Hridaya refers to the heart, Roga refers to the disease. So this is Hridaya or heart disease. And so Vataja type or Vata type heart disease is caused when Vata enters into the system of the heart, which includes the Rasa Dhatu and the Rasa Vahashrutas. And here what we see in the heart is a rapid heart rate. We see an irregular heart rate. We could see an irregular heart rate. We could feel that there is suddenly constriction in the heart. If there's blockage, the Vata dosha can cause a sudden spasm in the muscular layer, the Mamsa Dhatu of the channel of the heart. And so this is what happens in Vata type heart disease, and it creates pain when you get that spasm in there. So there's pain, there's irregularity, there's an increase in heart rate, and these are some of the common symptoms of Vata dosha. When Pitta dosha enters into the Rasa Vahashrutas and the heart, well, then there tends to be inflammation. And that's another very important component of heart disease is inflammation. There can be inflammation in the valves, there can be inflammation in the blood vessels that contribute to blockage. And so in addition to cardiac irregularities, there is also more of an inflammatory response happening in the tissues of the heart, and that's due to Pitta dosha. And Kapha dosha is more related to creating blockages and slowing everything down. Kapha dosha has a tendency to slow down the heart rate and to make the movement of blood through the heart more sluggish. And so that would be due to Kapha dosha. So any dosha can affect the heart, and that's very important to understand. An Ayurvedic doctor has to evaluate the patient in order to understand which dosha is disturbing the tissues of the heart. And also doshas combine together, and they influence each other. So sometimes a heart condition could be due to Vata Pitta, or Pitta Kapha, or Vata, Pitta, Kapha. And in fact, there are many, many, many subtleties that go along with that. And so there are many kinds of heart disease that are described in Ayurveda. Now, I want to talk about the heart and from another perspective for a moment. I want to talk about the heart as the bridge between the body and mind. You see, the heart is connected to the mind from an Ayurvedic perspective. That may seem unusual to you, but not from an Ayurvedic perspective. There are three upadoshas or subdoshas that are related to the heart and the mind. And this is pranavayu, saraka pitta, tarpaka kapha. Now I know, big words. So let's talk about what that means. These are said to be residing in the heart itself, but they're also residing in the head. So these doshas connect the head and the heart. And what that really means, the importance of this, is that what's going on in the mind affects the heart, and what's going on in the heart affects the mind. The heart is the seat of consciousness in an individual. So another way to say that is the mind affects consciousness, consciousness affects the mind, and they both affect the heart. In fact, the defect in the mind, the dosha, the defect in the consciousness, the dosha, is going to be experienced as heart disease in Ayurveda. Pranavayu is what brings energy or impressions into your mind and then down to your heart, which means that what you take in through your eyes, your ears, your nose, and your mouth influence your mind, right? If you're watching an intense film and you take in the violence, well, that affects your mind, but then your mind immediately affects your heart. So watching a film that is disturbing to you disturbs your heart. The same thing with anything you see, whether it's real or whether it's imagined. Anything you hear, if somebody is yelling at you or being mean to you or being abusive verbally to you, that affects your mind and it affects your heart. Whatever affects your mind affects your heart. Whatever affects your heart is going to ultimately affect your mind. They're interconnected to each other from an Ayurvedic perspective. Saraka Pitta is what digests in your mind. It's what digests in your mind, and it is also stored in your heart. In other words, what you take in through your senses has to be digested. And so how you digest your experience is going to affect your heart as well. So digestion of experience means how you come to understand it and how you come to resolution with it. Are you able to resolve the traumas of your life? As an example, resolution of trauma is a process of digestion in Ayurveda. So we have to digest the experiences of our lives, both the healthy things that we experience, but also the unhealthy things. We could call them junk experiences, just like we have to digest junk food. Okay? So if we digest them well, we will not be affected by them any longer than we have to, right? Only until that bad experience is digested. That's part of the process of healing from trauma in Ayurveda and from an Ayurvedic perspective. And the next dosha, or upadosha, subdosha, is called tarpaka kapha. Tarpaka kapha is really what tends to protect the heart from the excesses of stimulation, so that if we are overly stimulated or become overly intense, Tarpaka's role is going to be to try and soothe the heart. It's in our mind, it's in our heart as well. It affects the fluids that move through our nervous system. But in the heart, it's primarily there to protect against the disturbances of stimulation. Okay, so if it's in excess, however, we get a kapha type hridraga or kapha type heart disease, which means that those same factors that protect us in excess start to cause blockages or interfere with the movement and the functioning of the heart. So as you can see, our goal in Ayurveda is, of course, to balance the doshas, to make sure that our vata is healthy, our pitta dosha is healthy, and our kapha dosha is healthy. Don't forget, we have all three of these within us. We have them in a unique combination that makes up our prakriti, or our constitution. And they have a unique imbalance or disturbance going on in each of us right now, which is part of our vikruti, or just the current state of balance of these three doshas. The next thing I want to mention is that what's happening in your heart is not separate from what's happening in your lungs and in your respiratory system. Those of you who know Ayurveda know that the respiratory system is called the pranavahashotas, and it has its origins from an Ayurvedic perspective in the heart, revealing its intimate connection. And of course, in Western physiology, we understand that as well, that these two are interrelated with each other, that if the heart is unable to pump the blood out, then it may back up into your lungs and cause breathing difficulties. Likewise, a problem in the lungs will cause a problem in the heart. So part of keeping the heart healthy is keeping the respiratory system healthy. This is really essential, and this is where, of course, Ayurveda and yoga work together, because in yoga we do pranayama to keep the respiratory system clean and capable and healthy. And in Ayurveda, through our diet and through our lifestyle, we keep the pranavahashotas, or the respiratory system, very healthy. Now, the heart is also the location of the anahata chakra. The anahata chakra means the unstruck sound, and this is really an interesting name for this chakra. It gets its name because it continues to make this inner sound within us. Even though it's not struck, we don't have to do anything. The unstruck sound means that it's happening autonomically or automatically without us having to even do anything. And if you close your eyes really, and you close your ears really, you will be able to hear that inner sound. This is one of the things that occurs sometimes in meditation, that we're able to hear the inner sound of the heart. The health of the heart chakra is very important to the health of your physical heart. They're not separate from each other. We can think of the heart chakra as the energetic heart, the energy body. We could think of it as the subtle heart. It is that aspect of the heart that is going to circulate prana through the tissues that connect to that chakra. And so we have 72,000 channels in our bodies. They connect to the 7 chakras in our bodies, and each chakra connects to many, many thousands of small channels that affect our body. So the heart chakra affects the physical heart, it affects the lungs, it affects the thymus, it affects the muscles in the area, it affects the breast tissue. And if there's any dysfunction in the heart chakra, we will see that as a pathology in the heart now, or in any of those tissues. So what that means is we have to learn how to take care of our heart chakra. And the key to taking care of the heart chakra is the practice of non-attachment. It's the practice of non-attachment. The heart has many functions, and we think of the heart as being related to love. And it is, for sure it is. But love with attachment leads actually to more heart disease. Love with attachment can lead to severe grief, as an example. And grief is an important cause of Vata-type heart disease. Love with attachment can lead people with a Pitta disorder to anger. And so anger is in part of the origin of Pitta heart disease. When we practice non-attachment, our love moves from becoming conditional to becoming unconditional. Unconditional love is what will heal the heart. Unconditional love is what keeps the heart healthy. So the health of the anahata chakra is dependent upon our capacity to cultivate unconditional love. And this is very important. This is different than regular love. A lot of people mix that up. Regular love is more complicated. It has a watery component that is also related to the Swadhisthana chakra, which is related to desire. And so love comes in many forms. There is attached love, which actually comes from the second chakra, and there is unconditional love, which comes from the heart chakra. They're both love, and they're both beautiful, and they're both important. They just serve different functions. And in our spiritual development, we want to move toward non-attachment in our lives. And this frees us up from the burdens of attachment, and that frees up the heart. And that is so important to our health and our well-being. And so another factor I want to talk about that affects the heart is ojas. And a lot of you know that I'll be doing a course coming up on Monday that'll be specifically related to Ojas immunity and Ayurveda through the Shift Network. I'll maybe have time to mention more about that at the end. But Ojas is stored in your heart. And so you have two kinds of Ojas. You have Para Ojas and Apara Ojas. And Para Ojas is in 8 drops, and it's said to be in the heart. And this, if it's compromised at all, causes a radical instability in the heart, which can lead to your death. And then we have the Apara, or the secondary Ojas, that resides in the vessels around the heart. And this is the ordinary Ojas called Sleshmika, meaning more like Kapha type Ojas. This is the ordinary kind of Ojas that will circulate around your body and keep all the tissues of your body, including your heart, healthy. Okay? So Ojas is there. We must keep our Ojas healthy in order to keep our heart healthy. So we've got to care for the doshas. We've got to care for these 3 sub-doshas that I talked about, Prana, Vayu, Saraka, Pitta, and Tarpaka, Kapha. We've got to care for the Anahata chakra. We've got to care for our respiratory system. All this is related to the heart, and we have to take care of our Ojas. You see, all these factors affect our heart, which is why the heart is so vital. And it's also why heart disease is the #1 cause of death. It's because there are so many factors that affect our hearts, and our hearts are central to our well-being. Ultimately, Ayurveda teaches that in the cause of disease, it is impure or improperly formed rasa that returns to the heart that winds up disturbing it. And the importance of that statement is that another system is essential to the health of your heart. That's your digestive system, because rasa begins to form from the healthy digestion of food. Eventually, it makes it to its heart. It's going to go through several stages of digestion before it's ready to nourish the tissues of your heart. Well, now we also have to take care of our digestive system to keep our hearts healthy. So if we look at the key treatments then to taking care of your heart, we have a few things to keep in mind. Okay? The first is to be very careful about what you take into your body. That affects pranavayu. What you take in through your mouth, your nose, your ears, your eyes, and even your skin, your sense of touch. What you take in, the quality of your impressions are going to influence the functioning of your mind, right? Every time you have an experience, your mind acknowledges it. If you taste something bad, your mind goes, oh, that was terrible. If you taste something great, your mind goes, oh, that's wonderful. The mind is experiencing every impression. Okay, every impression your mind is experiencing. So be careful with what you bring in to your mind through your 5 senses, including your body, because your sense of taste affects your mind and your body. The #1, control what you take in, and take in only healthy, positive, loving, kind, doshically correct impressions through your senses. The second thing is Saraka Pitta we have to take care of. We've got to be able to digest it properly. Saraka Pitta really benefits from time of reflection and times of quiet. So please take the time to digest your experiences, to process your experience in the world. Don't be so busy that you never get time to process it. And take care of your Tapaka Kapha. And this is what nourishes your heart and protects you. And that actually begins with your digestive system. You've got to take in what is proper through your sense of taste. And you've got to digest that properly. And that's going to form the rasa that circulates around your entire body and nourishes your heart. Now, in addition to all of that, take care of your respiratory system. Take care of your pranavahashotas. You can do this through proper breathing practices. You certainly do this when you make choices in your life not to smoke, right? That's one of the worst things you could do for your pranavahashotas, which is why smoking causes heart disease. Well, it's one of the reasons. There are many things about cigarette smoke that damage the heart. It damages the lungs, and whatever damages the lungs damages the heart. One of the greatest things you can do to prevent heart disease is stop smoking now. Okay? It's one of the greatest things you can do. Got to take care of your Anahata chakra. So I want you to start cultivating non-attachment in your life, which means to let go and let things flow. Emotions may come up for you. Let them flow and let them go. in life. So important. Don't be so attached to the fears. Don't be so attached to the hurts. Don't be so attached to the future. I know it's easy for me to say that. I know it's the hardest thing in the world to do. And yet we have to remind ourselves to do that again and again, because all these things that we're attached to are transient, and we must come to realize that. We're not going to get to take them with us when we go. And we are all going to pass one day. And our goal is to live the full span of our lives and to be as healthy as we can through that experience of our full lifespan, so that we can be of great service and to be able to love more deeply in this lifetime. That's why Ayurveda exists, to help you with that. And the next thing I want to talk about is building ojas. You've got to take care of your ojas. And, if you're listening to this, then maybe you're already a part of our Facebook group, which is called Ayurveda, Yoga Nidra, and Ayurvedic Yoga Therapy with Dr. Marc Halpern. It's an open Facebook group that anybody can join. All right. And in there are hundreds of posts on ojas where you can learn how to build ojas. You can use the search bar in there to look up any term. So try this. Type in ojas and see what comes up, and read all the past information on building your ojas.